For that, Lynn, and please tell Jaria that we're sorry that that we missed her. But I did see a couple of questions, and then I have a couple of questions, and we can see if what else who's in the virtual room has other questions for the presenters. But Lynn, one question that Christy Johnson had from King County was about your iPad loan program. I see Oklahoma City responded, but are the iPads just for your public housing residents?
No, we have the ability to lend them out to public housing or housing choice voucher, depending on who we have that's interested. So it is not specifically just for public housing.
Great, thanks. And so one question for all of you, as you sort of, I guess, look into your crystal ball a bit and think about what things might look like after the pandemic is over, in quotes. What do you think will be the need for these programs moving forward? And what do you think will be the need? And how will sort of the digital needs of your residents have sort of been permanently transformed, do you think?
Just for myself, I certainly see, they mentioned it in the opening session, that that school systems, and I mean, certainly not necessarily an issue here in the South, but I spent many years in Denver, that there'll no longer be snow days. So what will that look like if children are expected to log on from home when there's adverse weather? So snow days, or here in the South, we have hurricanes. So what would that look like for our families who don't have access if that becomes a regular part of the education system?
I would also like to add, I think as either profit, nonprofit organizations continue to work through their COVID resolutions, their fixes to how do we continue moving forward, I think having this virtual ability for individuals that can connect it reduces barriers of transportation. It reduces barriers for families with childcare. I worked remotely, like with other folks this year, and you just have to say, excuse my children, they're in their Zoom call. But I see that this is going to continue because it does reduce several barriers. However, that just means we need to make sure that we are paying attention to the ever-growing digital divide that our residents are facing. But I do feel like virtual efforts are going to stick around.
Yeah, and I would add that I think this has been an issue for a lot longer than any of us have realized, but COVID has really put it to the forefront. And we've now seen firsthand sort of these systemic issues at play. And now we're being forced to address them. And if we don't figure it out now and keep working at it, we're just going to see an even greater disparity for these families going forward.
Definitely. Let's see, I see a question in the chat from Laura from Minneapolis. Providing tools through your learner programs is such a great start. How are you supporting the training needs so people learn how to use them? This is one of the biggest challenges in Minneapolis. And Lynn, I know you referred to your IT person creating a some sort of manual, which I'm sure if any of us have ever tried to teach, I'm thinking of trying to teach like my grandpa how to use an iPad. And so definitely some sort of material like that is going to be helpful. But what else are you thinking about doing, I guess, in that to help people with some of who might be a little more challenged with using new technology?
Yeah. Well, for Oklahoma City, one of our goals was really to develop a video with subtitles. So we're reaching more and more folks. We would love to have that video of how-tos, embed that on the desktop. So if a resident can flip open their laptop or turn it on, then they can simply watch the video. Like Lynn, we've provided instructions, easy to read instructions with step-by-step with pictures showing what the screen should look like, what button you push, things like that. Again, our long-term goal is to make a video with subtitles, so we can just embed that on the desktop.
Yeah, and just what I said is it, and I can't wait for Laura to make that video so that she can share that with me. But same thing is our team of ROS coordinators and multi-service coordinators. Everybody has jumped hands-on that if we have somebody who doesn't work well with the printed material or something, we have no issue. We will sit down with them to walk them through it. And we know that everybody learns differently. And for some folks, it's going to take some hands-on instruction, and we're fine with that and kind of built it in knowing that.
Yeah, I think too, and looking forward, one of the goals again for the loaner technology program versus giving technology is really assessing the needs. We've learned quite a bit after we started handing out our first round of laptops to our residents. We've had folks that have definitely been excited. I think my favorite story, I believe, and I hope I'm not getting this wrong, but we did have a 72-year-old female resident, very interested in loaner program, and she said she wanted to play games, and that is okay. That is okay with us. But these are the things we want to know. Our goal, if we do have someone wanting to learn how to apply for employment or to sign up for the vaccine, we want to track that. So rather during COVID, post-COVID, that we are having folks boots on the ground, meeting our residents where they are.
Thanks. And we had a question if either of you were participating in HUD's Connect Home initiative. So I see that Lynn has said no for Wilmington, but Laura, is OCHA part of that?
No, but we should be. We should be. We very much should be. That is a great opportunity that I believe housing authorities need to look at. We also need to look. It's not for the lack of information coming our way. It's the lack of time to dive into more and more information. Resident services has definitely been boots on the ground since the beginning of COVID. We are waiting for that day we get to take a break and start building on the foundation that we have so far. So we are not part of Connect Home, but we need to be.
Thanks.
Yeah,
oh, go ahead. Sorry.
No, that's okay. I was going to say, I agree with Laura here in Wilmington that we're doing lots of things that are in the ballpark of Connect Home, but we've not had a chance to apply. And I know it was just open not that long ago, but we were just not in a position to be able to complete that at that time.
Thanks, Lynn and Laura. And so we had a question about what is the outlook of HUD considering internet connectivity as a utility allowance for all residents of federally assisted housing? Great question. It's something that CLPHA has raised with HUD leadership, and we've certainly gotten the sense that there's some interest in exploring this. And there is a bill from from someone in the New York delegation on the House side that's been introduced. I'm blanking on the congressman's name, someone who was newly elected that would allow for, thank you, Jamal Bowman. That would make utility, that would make broadband part of the utility allowance. And so obviously a lot of sort of issues to work out, a lot of details to work out there, but definitely something that is I know is on HUD's radar. Let's see, just looking through the other questions. So, so one question about partnership. So obviously one of the reasons why you all are here is that you are examples of some of these great partnerships to work through some of the issues around the digital divide. So when you think about how you could further expand access to both devices and broadband for your residents, what other partnerships are sort of on your wish list that are in your community?
So I'm too excited to wait on you, Lynn. I'm sorry. Um, we are so excited. Resident Services is a new division within the Oklahoma City Housing Authority. So we have the pie in the sky dream. Right now, nothing is too big for us to accomplish. However, we do not have an in-depth relationship with our local school system. The Y has a great relationship with the school system, and that's something we need to work on. I noticed that several years ago attending the HousingIs Summit, how beneficial it is for housing authorities to connect with the educational partners. We have lots of partnerships with our higher education, local community colleges and so on, but not the educational side. We also have great partnerships with our federally funded community healthcare centers, but the local university teaching hospital that is top-notch here in the state of Oklahoma, we've not yet partnered. We've kind of dwindled in partnerships. So the two pie in the sky, hands together partnership would be our educational partners and our health partners. And many more others.
I agree with Laura, first of all, in the fact that one of the things on my agenda in the next year, now that things are a little more stable than when I started here, is that I'd love to deepen our relationship with our public school system here. I think that we have, we certainly deepened it already because of COVID in the distribution of devices and making sure that our young people were connected and that public schools knew knew what we needed. But definitely knowing that that this last year has caused learning loss in our communities, and trying to figure out how we make up for that and how we can partner with the school system to help make that happen. Agree on I think our connection. One of the things in the Wilmington community is our hospital was the community hospital was just purchased by Novant Health, which is a larger system. And so really creating a partnership with that larger system, and they're in the process of making decisions on some community healthcare clinics. And so figuring out how we fit into that discussion, knowing that a lot of our residents will be the patients at those clinics. So those kind of those are, I would say, probably the two things that are at the top of my list for the next 12 months. And then we've never turned down a partnership. So whoever shows up, I'm sure that, we would never turn anyone away.
Thanks, Lynn and Laura. I imagine a lot of those comments resonate with other PHAs. And the reason I should remember Jamal Bowman's name is that his policy advisor is going to be speaking on Thursday during another breakout session on what's being referred to as digital equity. And we will also have someone from the FCC who's going to be talking about the new broadband program that they have for low-income households that was funded through the December 2020 stimulus package, which is, I believe, a $50 a month subsidy for broadband. So that's definitely a follow-up to this conversation. So I'll just stop there and see if there are any other questions from anyone else in the room, either via chat or you can feel free to unmute yourself.
Emily, this is Nicole. I got a question that was sent to me, and I answered directly, but I thought I'd open it up for the other panelists maybe to provide some insight as well. But the question was around resources for grants, for technology or digital work, or for just resident services in general. So I know that on Thursday at the Digital Divide panel, there's going to be some talk around funding that's available through the FCC. I know a lot of PHAs have made their CARES Act money work in this regard, but I just wanted to maybe open it up for any of the panelists to see, where do you go to look for resources? Is it generally looking more towards your local partnerships, city money, where are you kind of finding funding to do this work?
So any opportunity we have to leverage resources, that's where we look to go first. And what I mean by that, for example, the Y, they have amazing mentor opportunities for youth, summer camp opportunities. That is something that the Y is good at. That's what they do. And so we're able to leverage that opportunity. As far as technology grants, the next step I make will probably be reaching out to our private funders here locally to see what we can do to enhance this program and to grow this program. We only have 18 kits. We've only marketed to 2 locations. And we are already getting such great feedback that we know this program needs to expand, regardless if we're in COVID or not. So leveraging resources, private foundations, and of course, any other opportunities that come our way, FCC or whatnot, what we can utilize, we will.
Yeah, we've looked at private foundations. We're actually working with Novant Health at the moment, and they are working at one of our centers. We're hoping to open it up this summer with a new computer lab for our young people. So that would be in addition to the lending program that we have. So we're right in the middle, fingers still crossed. We're hoping for some donations for computers as well. We work a lot with PCs for People, Tony Frank. They are an amazing resource to be able to provide technology at a reasonable cost, not just for your residents, but for your agency as well, for computer labs and things like that. And they also offer the access to hotspots, and I've worked with them for years. They're a great organization.
One thing that we've leveraged to help OCHA is our relationship with local school districts and actually getting our foot in the door very quickly with our State Department of Education, who was handed this huge chunk of money through the most recent stimulus package that was passed. And so what we've been able to do with them is really focus on our community outreach sites. And they're very interested in taking what we can do directly to the families. And so with that, we're able to take this money that is to be used to address learning loss and social and emotional health. And we're able to then funnel that directly to the residents through their community centers. And so it's kind of a roundabout way, but we are eventually getting it in the hands of the residents through being able to purchase additional Chromebooks. And that was something we did with the CARES Act money. We bought a lot of Chromebooks so that kids who showed up without their device, as Lynn was talking about, we could still help them log on. And we'll continue to look for those resources and try to use those funds as creatively as possible to meet the very specific needs that each community has, as opposed to just saying, well, this is what the Y does, so we're going to replicate that here. We're trying to tailor it. So if Oak Grove needs devices, we'll be able to funnel those funds to get devices for those kids. So.
Thanks, Lacey. And so before we wrap up, I just wanted to add that CLPHA is very interested in knowing what else we can do to help you all lessen the digital divide. So with the CDP grants, and we wrote comments to the FCC on the new broadband program, and we'll definitely be thinking about ways we can help you make sure that your residents know about that program. But if there are other things that we can do, please let us know. And so I'll just stop there and see if we have any final questions or comments. And I see that Ed Lowndes has put a link to a more detailed description of the broadband program. Great. Okay. Well, thank you. Thank you so much to our panelists. A virtual round of applause. We really appreciate it. And Ellen, please again, give our best to Jaria, and sorry that we lost her, but I hope she's safe. And so thank you all, and please join us for the networking session that starts in about 5 minutes in the main room. So thank you. Take care.
Thank you.